Here are more specific examples of how antimetabolites can interfere with prokaryotic cell function and growth and essentially slow down the growth of that microorganism long enough for other factors to help clear up the infection. Sulfa drugs interfere essentially with a particular pathway that are used for the production of purines and pyrimidines. Those purines and pyrimidines are going to be needed later on in nucleic acid synthesis. The trimethoprim that's often coupled with the sulfonamides are going to give us a sort of a 1-2 punch that also assist in the inhibition of precursors needed for the production of purines and pyrimidines. Notice the construction or the structure of the sulfonamide looks very much like a component that's needed in the metabolic pathway. So we could think of the sulfa as a competitive inhibitor because it's very much a look-alike. Its structure is very similar to the known component, para-aminobenzoic acid, that is needed for normal function of this metabolic pathway. Here we have specific examples of antivirals. Treating a viral infection is particularly difficult because we have to have a chemical that can actually get inside of our cells and inhibit or prevent the development of the virus inside of our cells. We do have antivirals that can prevent viral uncoating, so even if the virus gains entry, if it cannot get out of its viral coat, then we've essentially stopped the viral infection from progressing. We have nucleic acid synthesis inhibitors. We have inhibitors or antivirals that are going to prevent assembly and release. Anywhere along the way that we can interfere with the typical cycle of development of a virus, that's going to be one step closer to preventing that virus from essentially replicating and being released to infect other cells. Antifungals. Fungal infections are as difficult, in fact maybe more difficult to treat than viral infections because the structure of a fungi, either mold or yeast, are so tremendously different from eukaryotic cell structure and prokaryotic cell structure. It's often difficult to penetrate or get materials or chemicals through the cell wall of the fungi in order to target or prevent the growth of the mold itself or the yeast. Now, getting through the cell wall, we do have a few antifungals that will target fungal cell wall synthesis, same as targets for the nucleic acid synthesis in the fungi. Notice that the list of antifungals is pretty short for any of the modes of action. And that's another reason why it's very difficult to treat fungal infections. Oftentimes, it's hard to find just the right chemical combination that could essentially prevent the continued growth of the mold or the yeast. Side effects. Side effects or adverse effects simply mean that instead of killing the microorganism, the drug made you sick. Side effects can range from nausea and diarrhea to loss of hearing, loss of kidney function. So loss of hearing due to ototoxicity is a possibility for certain types of antimicrobials. Nephrotoxicity, or loss of kidney function because of the adverse effect of some antimicrobials, are possibilities. And that's one of the factors we often have to sort of weigh in the balance. Is it better to essentially try to tough it through some of those adverse side effects in order to clear up the infection, or simply allow the body to try and take care of the infection and not use the drug. It really is one of those balancing or very carefully weighed considerations, because, of course, we don't want serious adverse effects that would be even more life-threatening than the original infection itself. We also need to take into consideration drug resistance. Now, frequently, simply the use of an antimicrobial is going to encourage the growth of a drug-resistant cell. Since it's the drug-resistant cell or microorganism is often the one that will resist the effect of the original drug. Notice that a non-resistant cell has no defense. There's no defense mechanism at all. The drug is allowed to gain entry and perform the task for which it's designed. For the resistant prokaryotic or eukaryotic cell, but usually we're thinking of examples in bacteria, oftentimes we have different types of resistance factors or mechanisms of resistance. For some bacteria especially, we have essentially efflux pumps that eject the antimicrobial as soon as it's introduced inside the cell. This simply is described as increased elimination. The drug might get in, but it doesn't stay long enough to do its job. We can have decreased uptake of the antimicrobial. By decreased uptake, essentially, the entryways or the channels through which the antibiotic or antimicrobial would enter are altered and do not allow the drug to pass through the cell wall and cytoplasmic membrane. We have alterations in the target molecule. Perhaps whatever the original target inside of the cell was is now altered due to mutation, and even if the drug gains entry into the cell that's causing the infection, it doesn't do anything because it cannot bind or attach to this newly altered target. And then there are even more likely drug inactivating enzymes. The drug inactivating enzymes, like beta-lactamase, also called penicillinase, are essentially enzymes that are going to catalyze the breaking or the modification of certain bonds in the antimicrobial to essentially result in an ineffective or inactivated drug. This illustration tries to demonstrate how simply the use of an antimicrobial encourages the growth of drug-resistant microorganisms. We start at the top with a typical population of microorganisms. In amidst all of those different cells, we find that naturally occurring resistance factors are already present in some, but not all, ideally, the original target cells. Again, this is a population of microorganisms that have never been treated before. That's why we have more susceptible cells surrounding this one individual resistant cell. With the use of the antimicrobial, especially early on in treatment, the susceptible cells will die off the quickest, leaving the more drug resistant. This is part of the reason why we want to always take our medication, especially for the removal or the elimination of an infection, for the full prescribed number of days. Because what we'll find is if we sort of partially treat an infection, then there's actually a whole spectrum of susceptibility to the microorganism or antimicrobial drug in this bacterial population. It's not always just all susceptible, all resistant. Sometimes we have some cells that have intermediate resistance or susceptibility. So when we partially treat an infection, the susceptible cells die first, but the remaining cells with varying degrees of resistance will continue to grow. And the more often we treat, and if we treat inappropriately, the more we encourage the hardier, more drug-resistant cells of bacteria to keep on growing and overgrow the population of susceptible bacterial cells.